Waiting for Liver Transplant at the University of Washington Medical Center, Part 3. Welcome. In this transplant educational segment, we will review what to expect when a patient gets called in for liver transplant, your surgery and hospital stay, potential complications after surgery, as well as future follow-up care. We will also discuss transplant insurance, as well as medications you will be prescribed after liver transplant. The University of Washington uses a transplant call center to manage all transplant calls at the time of a liver match. Since the call center is an outside agency, calls will come from an area code outside of Washington state. The call center will provide you with details such as when to arrive at the hospital and any other details the surgeon may ask. Remember, patients listed for transplant can be called in at any moment. You must always answer your phone and have a voicemail set up to retrieve messages. If the transplant call center cannot reach you or your alternative numbers within 1 hour, our surgery team will contact the next candidate on the list. When you receive a liver offer, the transplant call team will let you know what time to arrive for admission, as well as other essential information you may need to know. Most patients will have ample time to arrive at the transplant center after getting called in. Many patients ask what they should bring to the hospital when they get admitted. As with all major surgeries, we encourage patients to bring comfortable clothing and toiletries, as well as any medications you're currently taking. After transplant, you will need a floor scale, a thermometer, and an automatic blood pressure monitor. If you live nearby to the hospital, your caregiver can make sure these items are available upon discharge. If you live far away from the hospital and will need to recover in the Seattle area, you should consider bringing these medical devices with you when called in for liver transplant. Once matched for a liver transplant, you will be admitted for liver transplant surgery. Some patients may be called in for a backup liver offer. This means that there is a patient who is first in line for the transplant, but there is a possibility that the patient may not be a suitable candidate. We encourage all patients to come in for every transplant offer. Patients have many questions regarding the surgical procedure and hospital stay. Most transplant surgeries take 6 to 10 hours, and patients generally spend 7 to 10 days recuperating in the hospital. Patients wake up in the intensive care unit on a breathing machine known as a respirator. This will be removed once the patient is stable and able to breathe on their own. Most patients spend 1 to 2 days in our ICU and then continue to recover on our general transplant floor. Anti-rejection medications are given immediately to help prevent rejection of the transplanted organ, and pain medication is used to help manage postoperative pain. Please note our hospital policy regarding visitation has changed over the years. We ask that you review our current visitor policy on our hospital website before arriving to visit a patient at our facility. The University of Washington prides itself with a transplant wing where our patients recover. Having a dedicated transplant floor provides our patients with expert care by staff trained to care for transplant patients. Most patients spend about 1 week recovering from transplant surgery and preparing for discharge home. It is during this portion of your hospitalization that you will meet with your post-liver transplant nurse coordinator. These nurses provide education on what to expect upon discharge from the hospital and any needed follow-up care. Our pharmacy team will also meet with you and your caregiver prior to discharge to provide education regarding medications prescribed and their side effects. As shown in this slide, most patients will be ready to go home once their liver function is stable and able to eat and tolerate all medications. The hospital will make sure that your pain is under control. Be aware that the length or stay in the hospital can vary substantially from patient to patient. Complications immediately following transplant surgery are not uncommon. Our surgical team monitors all transplant patients for any technical issues, such as bleeding, formation of blood clots, or leakage of bile. Most technical complications can be treated by our surgical team immediately after transplant. The complication of rejection is also not uncommon and is treatable. Routine lab work helps to monitor the liver's function and to determine the correct amount of anti-rejection medication needed. Some patients may need frequent changes in their medication dosing. Other patients who may be experiencing rejection will need further testing as well as hospital admission. Please remember that anti-rejection medications also lowers your immune system, which can make you more susceptible to infections. All patients should remain vigilant by washing their hands and limiting their exposures to others who are ill. Although our transplant team continues to assess your liver function at every visit, recurrent disease has been seen in some of our transplant recipients. This means that the cause of their cirrhosis came back, or that liver cancer recurred. We will keep close watch over your liver to detect any disease recurrence for early treatment. Taking anti-rejection drugs places patients at a higher risk of developing cancers, such as skin cancer. We encourage all patients to schedule yearly dermatology visits to screen for skin cancer, as well as to use sunscreen. Finally, our transplant team monitors for other cancers, such as lymphoma, which is a cancer of the germ-fighting cells known as the lymphatic system. Patients who take anti-rejection drugs have been shown to have a higher rate of developing this kind of cancer. Our transplant surgical team will formulate your discharge planning. Once discharged, you will continue to recover at home or nearby to the University of Washington for approximately 3 months. The first few days at home can be overwhelming as you begin to adjust to life without the transplant team monitoring you 24/7. Remember, your post-liver transplant coordinator will send you home with detailed information as to what to expect upon discharge, as well as emergency contact numbers should you have additional questions. Most patients ask about their incision site and what to expect. Patients typically have surgical staples in place, which will be removed during a follow-up appointment. Surgical incisions need to be kept clean and dry, and your surgery team will let you know when you can begin to take baths or swim. Surgical drains may also be placed near the liver. You will receive instructions on how to care for this. Some patients may need to stay within the Seattle area after transplant due to travel distance from home. Patients should stay close to Seattle for approximately 3 months after transplant. However, this time period is dependent upon an individual's recovery. In this slide, we have identified some important points for you to remember after transplant, such as not lifting heavy objects or putting pressure on your new liver. You will be expected to monitor your own vital signs at home and keep a diary to show your providers when you come for follow-up appointments. Your anti-rejection drugs, also known as immunosuppression drugs, can never be missed. This medication is critical to maintain your new liver function. Should you run out of medication, you will need to reach out to your nurse coordinator immediately so that arrangements can be made to obtain your medication. Your post-liver transplant coordinator will meet with you and your caregiver while hospitalized so that you will have information regarding what to expect upon discharge. Your nurse will provide you with a contact number to call should you experience any sudden changes in your health. Make sure to keep this number with you at all times so that you can reach the transplant center. While recuperating at home, all post-surgical patients will also need to return to the transplant clinic 2 times per week in order for our transplant surgery team to evaluate your recovery process. Patients begin their day with routine lab work and spend most of the morning at the hospital. Your caregiver will need to be present for these visits. During this appointment, you'll be meeting with your transplant surgeon, your post-transplant nurse, the pharmacy group, and your nutritionist. Adjustment to medications may be made, or additional testing may be scheduled during these appointments. As you progress with recovery, the frequency of these follow-up appointments may decrease. Recovering from liver transplant can take a long time, especially for patients who are very deconditioned prior to transplant. Once our team determines you have sufficiently healed from liver transplant, you will be checked out of the transplant surgery clinic, and the frequency of your visits with our team will move to a second phase. Patients who live far away from the hospital can return home, and follow-up visits to the transplant center will be less frequent. Most patients return at 3 months, 6 months, and then every year as you celebrate your transplant birthday. Blood testing to monitor your liver function and anti-rejection medications will be managed by the post-transplant team. They will contact you when lab work is required. All medication dosage changes will be made by our transplant hepatology team. Your local physician should never make changes to your transplant medications. Living with your liver is a lifelong journey. Thank you for sharing your liver transplant journey with us. Let us now review transplant and prescription drug benefits. We will also present information regarding medications taken by patients after liver transplant. Organ transplantation is expensive, as total transplant costs can reach up to $2 million. We verify that all transplant patients have adequate insurance benefits at the time of transplant listing. However, not all plans are the same, and we encourage you to reach out to your insurance transplant case manager to understand your benefits now. Be sure to ask about travel and lodging benefits should you live far away from the transplant center. For patients who are interested in our Living Donor Program, be sure to check to see if this benefit is part of your plan. Prescription drug coverage is needed for all patients to help offset the costs associated with transplant medications. Some patients may need to purchase supplemental policies to help with the costs associated with transplant. Should you have additional questions or feel you may qualify for financial assistance, you can reach out to our Financial Counseling Center at the number on the screen. Insurance terms can be confusing. To simplify this, we will review some basic insurance terminology. A deductible is the amount of money you must pay out of pocket per year. Once you pay your deductible, your insurance begins to make payments. Some patients may have a copay for a medical visit. This is a fee that you pay with every visit and is set up by your insurance company. Coinsurance is the percentage of the medical costs that you have to pay after you have reached your annual deductible. Finally, your out-of-pocket maximum is a predetermined sum of money that you must pay prior to your insurance assuming full payment of all your medical costs. Getting familiar with your insurance benefits will help to limit any surprises with future bills you may be responsible for. All patients will receive a printout of your current benefits from our transplant center for review. You will need to sign and return this to our transplant center. Should you change insurance, you will need to let our center know so your new plan can be reviewed to ensure your transplant benefits are adequate. It is important to plan ahead for your transplant medications. You should check your coverage with insurance and plan ahead for costs. Transplant immunosuppression medications must be taken lifelong after transplant. In order to monitor the blood levels of your medications and to watch your liver function, you will need to have blood tests monitored lifelong. It is critical to have blood tests as directed by your post-transplant team. Your transplant manual has additional information about medications and monitoring. Anti-rejection medications are very expensive, often costing up to $1,000 per month. It is therefore important that you review these costs and understand your insurance pharmacy benefit. Familiarize yourself with copays, deductibles, and the potential need for supplemental insurance plans. Our transplant financial counselors can provide additional information about Medicare Part A and B, as well as Part D, Part C, Medigap, and the potential need for a supplemental policy. If you are ever unable to afford your transplant medications or have any other barrier to obtaining transplant meds, you must contact the transplant center immediately. When you come to the hospital, you should bring all of your home medications. Be prepared that your medication list will change significantly after transplant. Many medications will be stopped, and many more will be started after transplant. The transplant pharmacy team will meet with you and your caregivers several days after transplant and will teach you about your medications. You will be supplied with a detailed medication list and a pill box prior to hospital discharge. In order to prevent your immune system from attacking your new liver, which is called rejection, you will need to take anti-rejection medications, also known as immunosuppressants. These medications work by suppressing your immune system. There are several different immunosuppressant medications you will need to take, and each works somewhat differently. These medications will need to be taken for the rest of your life, although the number of medications and their dosages may be reduced over time. Sometimes rejection develops despite taking medications, and patients may need to be treated with stronger IV medications. The most common anti-rejection medication used after transplant are tacrolimus, mycophenolate, and steroids, such as prednisone. It is important to take these medications at the same time each day. It is critical not to miss any doses. If doses are missed, you must call the transplant center for direction on what to do. Immunosuppressant medications can cause side effects such as nausea, diarrhea, and headache. These medications can also affect your blood counts and kidney function. Therefore, careful laboratory monitoring is very important. Due to suppression of your immune system, you may be more susceptible to certain infections, and there also can be an increased risk of skin cancer and lymphoma after transplant. To summarize, it is very important that you familiarize yourself with your insurance benefits, including pharmacy coverage, and check on these benefits every 6 to 12 months. You must notify the transplant center with any changes to your insurance coverage. Always let us know if you have any barriers to obtaining your transplant medications. Continue to learn about transplant medications, reviewing your guidebook so that you will be ready at the time of transplant. Thank you for watching this segment on liver transplant, transplant insurance, and prescription drugs. Should you need additional information, please reach out to your transplant nurse coordinator. You can now move on to Part 4 of this educational seminar.